December 4th, 2025. End of the year, and this will be our last case for today. Our patient underwent the Deuk laser disc repair, 4 discs last week, did fantastic. He was losing strength in his left arm, left bicep deltoid, almost no strength at all. He had bone spur herniations at each level, pressing on nerves, the spinal cord, causing neurological deficit, loss of strength, atrophy in his entire right side. Now he comes back, he has normal strength. So we gave him back his strength in his arm, and we helped with the movement of his neck. However, now he has facet joint pain, which a lot of people develop after getting your disc fixed, because a lot of times injuries are to the disc and the facet joint both. He had a diagnostic facet block yesterday, and that diagnostic block ended up getting rid of about 80% of his pain. He still has a trigger point as well in the trapezius on the right, which needs PRP, but we're going to be treating his facet joints on both sides from C3 to T1, and we're going to be treating his trigger point. But Dr. Patel will do the PRP. I don't do PRP. Dr. Patel, my partner, does. So we're going to first go in and treat the facet joints. You can see C2-3 up there, right where the probe is. And I'm going to go in there and I'm going to make 2 incisions per side. I sometimes will do 1. However, this patient has so many arthritic, painful facet joints, literally from C3 all the way down to T1, that I'm going to break it up and do 2 separate incisions to minimize the amount of trauma. How are we on blood pressure? If there's any questions, feel free to ask. In the meantime, Henry, will you share with our audience the 30 causes of neck pain?
Of course.
I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. So with our video, we've shown you the 30 different things that are very specific sources of neck pain. Each one is called a pain generator because they generate pain. And it turns out that humans have 30 very specific pain generators in their neck, 30. Now, not everybody has pain from all 30, right? So when a patient comes to us with neck pain, we have to ask which of those 30 is this patient's going to have. And I would say the average patient has 4. Is that our picture? 4 very specific causes on average. It could be 2 discs and 2 facet joints. It could be 4 facet joints. no discs, but the most common source of neck pain is a damaged disc. The second most common cause of chronic neck pain is a facet joint that has arthritis. Now just take a look here at this x-ray picture. We're going to show you, Jordan's going to point out the severe arthritis of the facet joints. So show us the vertebral body. There's the vertebral body in the middle. And then the facets are on the side of the spine. You have a left and a right facet. Show us the joint there just below my probe. There's the joint. Go left to right, please. Yep, all the way to the right. Keep going. That's the joint right there. And all that black area is basically sclerosis, which is thickened bone that comes from arthritis affecting the joint. That doesn't happen overnight. It takes many years to form. For this particular patient, he injured his neck. Let's go ahead and do our second incision. Let's see. I wonder if I can get the rest of these from here. Be nice if I don't have to make another incision. This patient had trauma to his neck about 5 years ago, and that trauma caused his discs to herniate, but it also caused his facets to become damaged. He found us, thank God, and came to Deuk Spine. He had his disc surgery last week. Now he's having facet surgery. I told him when I did his disc surgery, I said, listen, there's a very high chance you're going to need to come back to get your facets treated, but let's wait and see, because I don't want to just do the treatment if you don't need it. Well, he started to experience pain in his neck on both sides with rotation. And part of the reason is quite interesting. There's only one surgery in the world that I'm aware of that will actually restore movement to your neck. Okay? Restore movement means give you back movement. And that's our Deuk laser disc repair. Now, how does it do that? There's a difference between taking away movement, preserving movement, and restoring movement. Now, taking away movement is a spinal fusion. Spinal fusions take away movement. Preserving movement is supposedly the artificial disc, but it doesn't work most of the time in my experience. Patients who have the artificial disc end up fusing their spine anyway. So where the surgeon does the artificial disc surgery, they end up fusing, and they end up with a fusion. So they're losing the movement. So fusion and artificial disc, I'm going to make another incision. Both, you lose movement. Artificial discs that don't fuse, they call it motion preservation. Is that deep? Deep? No, deeper? I need deep. Okay. So you have losing motion or motion losing procedure, which is fusion and most artificial disc surgery. Is this X-Pro? Mm-hmm. Oh, okay. So fusion, you lose movement because you're fusing the bones together. You're getting rid of the joint. Do you want to do it later or now? Yeah. Artificial disc, if it works properly, which is not most of the time, it's just rarely will it work properly, you're going to preserve movement. You preserve what you have. But with the Deuk laser disc repair, I have seen restoration of movement, which is exceptional. Come on. Restoration of movement means you get your movement back that you lost. Deuk laser disc repair is the only surgery I'm aware of where you can get your movement back. Okay? How do I know that? Because I saw that with this patient. We went into his neck for the Deuk laser disc repair last week. He had zero movement of his bones, his vertebrae, vertebral body specifically, at the disc. We could see it with the endoscope, no movement. And then as I'm using the laser to clear away scar tissue, calcium deposits, other things, you could see the bones starting to move. They were literally, his disc was starting to move again. So it went from not moving at all, you could see it endoscopically not moving, to actually moving. Well, that's great. You get movement back with the Deuk laser disc repair. It's the only surgery I'm aware of that gives you back movement. However, there is a problem, and that is once you get your movement back, your facet joints might start to hurt because facet joints also move. And his facet joints were definitely injured during his traumatic event that caused his disc injury. So he had both facet pain and disc pain, but the facet pain didn't come on until after surgery. And we see that in about 25% of our patients that we operate on. We give them facet pain after the surgery. So it's it's not a risk, but it's one of the, I guess, negatives of getting movement back in your neck is that you can start feeling the arthritis in your facet joints, and that's what happened to him. But the good news is that it's an easy fix. All we got to do is go in and kill the pain nerves. It's called a rhizotomy, where we go in and destroy the pain nerves to the facet joints. Henry,
Yes, sir.
will you share with our audience the Deuk plasma rhizotomy for cervical facet pain?
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that injuries to the facet joint cause a tear in the capsule around the joint. That capsule tear never actually heals properly because, well, let's face it, the only way to get it to heal is to stop moving your neck. And who wants to stop moving their neck? We all go and move our neck every day. As we're walking down the street, we're using our neck to look left, look right. And so, Sean? Yeah, basically what I'm saying is it's very hard, Sean, to not use your neck, right? We all know that. We use our neck, we use our back, we use our hips, we use our joints every single day of our life, unless you're just laying in bed constantly, which nobody wants to do. So, he started to use his neck after his surgery, and lo and behold, his facets were hurting because he had injured the capsule in the past, and it never healed properly. Okay, so that's how people get facet syndrome. Trauma to the facet joints, same time as they traumatize the disc, and it never heals properly, and you get this chronic inflammation happening in those facet joints. All right, go ahead. Henry, I know we have a question.
Yes, coming from Lanu on YouTube.
Yes, Lanu.
Asking, martial arts legend Bruce Lee took a lot of falls and hitting on the ground. Have you noticed he has signs of herniated disc in some of his movies?
No, I never noticed any signs of herniated disc in Bruce Lee's movies because he was always moving beautifully. Enter the Dragon, Return of the Dragon. all of his movies, the Hornet, the Green Hornet, right? He didn't show any evidence of pain. You know, I think the reason he didn't was because he probably had intact spine. Like, he didn't have trauma to his spine, right? Why would he have trauma? He was too fast. Nobody could hit him. So he was always faster than his opponents. He would always hit them before they could hit him. So maybe he didn't have trauma to his joints, you know? He was just too fast. That's what I think. He was untouchable. Bruce Lee is definitely one of my favorite martial artists to watch. 3 minutes, you know, his old movies. If you haven't watched those movies, they're some of the best movies ever made. If you like martial arts, fantastic. Yeah, that's great. Yeah, I'm not seeing much bleeding at all. All right, we're just about done. We're working our way down the spine, and we're treating the pain nerves called the medial branch of the dorsal ramus. My goal here is to destroy them by cutting through them. Cutting through a pain nerve is called a neurotomy, and neurotomy is not normally done with radiofrequency ablation because the tools used for radiofrequency ablation are a needle, and you can't cut through a nerve with a needle. That's why patients keep coming back after they get the RFA, and they keep getting more treatments, which is great for the doctor, the pain management doctor, great for the company that sells those probes, but it's not good for the patients. Patients want to be cured of pain. They don't want to have to keep coming back to the doctor. What Deuk Spine offers to our patients is something unique. We can actually cure their pain as long as we can identify where it's coming from. Any other questions?
At this moment, no current questions.
We're just about done, so if you have any other questions, this would be the time to ask. But you can see how arthritic those joints are right below my probe. It's amazing. It's about C5, C6, C7. Getting down to the base of his neck. Shot. All right, I'm going to make another incision to treat the rest. So because he has so many facets I have to treat, I'm doing multiple incisions. Save the last little bit. And knife. Yeah. Shot. Shot. All right, we're just about finished with this gentleman. He's been suffering for a long time. He's a good man, and I'm very happy that he chose us to help him. I've just got to get down to these last couple of facet joints. You could see how full of arthritis they really are on that x-ray. Shot. Sean, any other questions?
At this moment, no current questions.
Sean? Right. Well, we're going to wrap this up in just a minute, and hopefully we'll be back next week with some more surgeries. We actually, we have a patient next week coming from Kuwait. He will be joining us at Deuk Spine to have his back and neck fixed. He's traveling halfway around the world because he knows Deuk Spine is the best. We have the best treatments in the world, and he's traveling from Kuwait to have the best. He has nothing that could block him. He has access to every doctor in the world, and he's chosen Deuk Spine Institute. He's made a wise choice. We'll see him next week and fix his back and neck. So we had to do 4 incisions. Each one is 4 millimeters, and we've lost probably, I don't know, maybe a cc or 2 of blood. Not much. Thinks you can go ahead and go to a testimonial.
Copy that.
And good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and FACET joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option. because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.